Welcome to Wednesday's edition of COVID-19. Korea has recorded more than 380 infections today as community transmissions continue to challenge containment efforts. Meanwhile, the global tally has surpassed 60 million cases in less than a year since the first reported case in Wuhan, China. Our Kwon So is standing by with details on that. But first, Soa, do tell us about the situation here in Korea.
Well, Sunny, the situation in Korea might get worse than the situation we had back in August. And some authorities are actually saying the situation is already worse than that. We're seeing a number close to 400. 382 infections were confirmed this Wednesday. And when it comes to local transmissions, 363 is the highest figure in 3 months. So dating back to August 27th, when the country reported 434 infections. Today's figure is similar to what we had on last Saturday, but a slightly higher number of domestic infections and also an on-week jump by almost 70 cases. And that brings the total here in the nation to 31,735. We also have 3 additional fatalities, 276 more people in quarantine or under treatment, and some 100 people who have made a full recovery in the past 24 hours.
And so how are local authorities responding to this persistent rise in cases in recent days?
Well, Sunny, we have been under level 2 social distancing measures for the second straight day now. So while many bustling streets, restaurants and coffee shops have become visibly empty, the virus is still spreading and unfortunately invisibly. But that's because the effects of the enhanced social distancing measures, if they are strictly abided by, are expected to kick in beginning next week. Health authorities actually made that prediction today, calling for extra precautions during this crucial time. First off, to cancel any gatherings for the time being and stay at home, as well as refraining from visiting high-risk public use facilities, especially if masks are not worn at saunas, for instance. Also, people who show symptoms of the virus are asked to get tested as fast as possible to avoid secondary transmissions. And we are dealing with these secondary or tertiary, these chain transmissions across the nation, and especially here in the metropolitan region. Around 260 cases in this region alone. So Seoul, Gyeonggi-do Province, and Incheon, the capital Seoul, now has a total of 7,900 infections. So we really need less movement across the country. But in fact, government data showed today that after the country or the metropolitan region went to 1.5 level social distancing measures, movement last weekend has dropped by over 10% compared to the weekend before. And this is needed because the virus is spreading to across the nation. Also here, Jeju-do Island had 3 infections this Wednesday. So we have to avoid these chain transmissions across the nation.
Right, so, and what's frightening is, as you predicted yesterday, the global tally of total infections, that is, has surged past 60 million, as I mentioned at the start of the program.
Right, Sunny. While here in Korea, we are dealing with a 3rd wave of the coronavirus with over 30,000 cases. And Korea actually ranks 93rd now in the global ranking, meaning the situation abroad is getting worse. So, as you said, 60 million cases have been confirmed now. Just look at these numbers. It took 179 days for 10 million people around the world to get infected by the virus. But the virus is spreading at much faster rates now, 3 weeks from 40 million to 50 million, and now 16 days. So almost just 2 weeks it took for 10 million people to get infected by the virus. So let's take a look at where the situation is worse. But before that, now as of noon Korea time, we have almost 100,000 new additional cases past that 60 million mark. And the concern here with fatalities, those are rising at fast rates as well. Almost 13,000 new deaths in the past 24 hours. Now let's take a look at the hotspots around the world here. The U.S. with almost 13 million cases. And it's not only European countries that are now dealing with resurgences, such as Germany, which has just surpassed Peru in the past day, but also countries like Mexico and Argentina. So Latin American countries are also seeing faster surges now. Let's take a look at some of the cases, the daily increases here. I just talked about Latin American countries. Mexico, over 10,000 infections in the past day, while this number was below 10,000 in recent days. And of course, the U.S. still seeing over 100,000 cases on a daily basis. And Poland here with 32,700 new infections. That's almost double the increase we saw the day before. And those are the updates I have for now. See you back tomorrow. Sunny?
All right, so thank you for that for now. Right, back here in the local arena, as part of efforts to better protect the young, school authorities have decided to close, that is, their compounds and classrooms. For more on this measure, I have our Kim Hanul here in the studio with me. Welcome, Hanul.
Good afternoon.
So tell us more about the school closures.
Sure. So as of 10 a.m. yesterday, a total of 184 schools nationwide decided to close its doors and switch to 100% distance learning. This is the highest figure reported in 2 months. Moreover, 20 additional schools were shut down compared to Monday. The number of school closures surpassed 100 last Thursday, and that figure has been growing ever since. The last time Korea saw a figure this high was in September. Also, with only 9 more days to go until the college entrance exams, all high schools nationwide will transition to remote learning starting tomorrow.
Right, Hanul. And speaking about the college entrance examination, I hear that President Moon Jae-in has urged for public support in ensuring a safe test this year.
Right, so President Moon Jae-in posted a message calling for public support on his Facebook and Twitter accounts, underscoring the need to flatten the curve ahead of the annual college entrance exam. The exam is scheduled to be taken on December 3rd by nearly 500,000 students and others across the country. And with only 9 days to go, President Moon said it was everyone's duty to ensure that the College Scholastic Ability Test, or CSAT, is held safely. The president added that the best way to achieve that goal for now is to break the rising trend of infections at the earliest possible date.
And I understand those looking to enter college this year, this is one of the first hurdles they're facing after they've taken the test. They have many more ahead of them.
Right, so once you start applying for college, the next step in the admissions process usually includes interviews in most cases. But under the circumstances of COVID-19, in-person interviews may not be an option. So that's why Korea's education minister urged colleges to conduct video interviews instead. Take a listen.
The Education Ministry will designate the period from December 1st to the 22nd, when many college admission tests are held, as a special evaluation period. We believe colleges should consider holding more remote interviews in the absence of extenuating circumstances.
She also asked colleges and universities to restrict the use of rooms reserved for interviewers and interviewees, and keep a separate lab room ready in case of an emergency. Also, with regards to the surge of coronavirus cases in college districts, the education minister requested colleges to utilize QR codes in libraries and cafeterias where a lot of students tend to congregate.
Meanwhile, Hanul, what's in store for those taking the GED exam?
Right, so students in Seoul who are preparing to earn their high school diploma through the Korean GED exam, or also known as 검정고시 in Korean, will be receiving some online help from the Seoul city government. The Seoul Metropolitan Office of Education announced yesterday that it will strengthen its program to support high school equivalency test takers. The new program will reflect the changes in the national curriculum in 2015 and offer virtual mock exams once a month to adhere to prevention measures and guidelines amid COVID-19. The program will also offer GED classes online and mentoring services that match GED test takers with college students.
Hanul, one final question before you go. I hear daycare centers here in capital Seoul have been asked to close doors.
Right, starting yesterday, Seoul city government ordered all daycare centers in Seoul to shut down. More than 5,300 daycare centers in Seoul will be affected by this new mandate. This is part of autonomous measures taken by city government's Level 2 social distancing measures, which go beyond the central government's Level 2 social distancing guidelines. Level 2 measures recommend but do not mandate the closure of daycare centers, but the city has ordered them to close indefinitely, given the fact that cluster infections have recently emerged at such facilities. However, emergency childcare services will still be available for children with working parents or those unable to be taken care at home.
Well, that's good to know. All right, Hanul, thank you for the coverage. Hope to see you again soon.
Right, see you then.
In other news, Korea's professional volleyball league began last month, and in this next report, we take a look at the COVID-19 measures in place at stadiums there to ensure safety.
The Korea Volleyball Federation had increased the crowd capacity to 50% starting the 7th of this month. But as health authorities raised the social distancing level to 2, now it is reduced to 10%.
So today we are going to look around the stadium and see how current measures are being carried out.
Amid the COVID-19 pandemic, the sports ministry is limiting the stadium capacity according to the level of social distancing measures. On game day, the KLVO thoroughly disinfect not only the whole stadium, but also bathrooms where spectators are using. In addition, each team has its own quarantine inspector.
질병관리청에서 준비한 또 요청되는 어떤 상황에 대해서 고열자에 대한 대응책을 감독관이 총책임하에 진행을 하고 운영을 하고 있습니다. 선수들 입장 게이트와 출구 게이트를 별도로 두었고 역시 관중도 관중 입장 게이트와 출구를 동시에 둬서 이원화시키는 게이트를 통하고 또 거기에 대한 방역에 대해서 수칙을 지켜나가면서 안전한 경기 운영할 수 있도록 저희들이 구축을 해놓고 준비하고 있습니다.
To make sure that every game is played under safe conditions, all 9 volleyball stadiums are operating quarantine gate.
So the game is about to start, and for spectators to be allowed to enter the stadium, they must go through something extremely important, which is quarantine check. And this gate behind me will allow spectators to enter the stadium safely.
Before entering all stadiums, all people must go through the quarantine gate to ensure everyone's safety.
So as you saw, you have your temperatures checked and the gateway sprays disinfectant to your whole body, and now you have the QR entry log checked. It's such an easy and fast way to enter the stadium.
마스크가 많이 불편하긴 한데 또 마스크를 쓰는 만큼 또 경기를 일단 직관을 할 수 있는 게 좋은 것 같아요.
생각보다 되게 꼼꼼하게 방역을 하고 있어서 좀 놀랐어요. 방역을 위해서라면은 꼼꼼하게 마스크 착용을 하고 관람을 하는 게 안전하지 않을까 생각합니다.
All spectators are required to wear face masks at all times. They must maintain a certain distance from each other and they cannot cheer out loud.
지금 시행되고 있는 질병관리청에서 1단계부터 5단계까지 구분이 되어 있잖아요. 거기 기준에 맞춰서 저희들은 방역을 아주 철저하게 준비를 할 것이고 본인 스스로에 대한 개인 방역이 철저히 좀 이루어져서 손 소독이라든지 사회적 거리 두기를 좀 철저하게 지켜주시고 그리고 선수들과의 멀리 함으로써 선수에 대한 안전 그리고 개인에 대한 안전을 잘 지켜줌으로써
As you can see, the Federation is doing its utmost effort to thoroughly implement quarantine measures. Although we cannot cheer out loud just like we did in the past, still we are lucky enough to watch the game in person. So please remember to follow prevention guidelines at all times. This has been 신세벽.
The pandemic has thrown many countries across the globe into recession this year, yet pundits believe proper preparation for the post-pandemic era may serve to turn this crisis into an opportunity. So what are Korea's strategies to this end? Well, to answer that question, I have Peter Bint here in the studio with me. Welcome, Peter.
Hello, Sunny. Pleasure to be here.
Thank you for being with us. Peter, Korea's relative success in containing the virus has lured foreign investors into the local stock market and
Yes.
Observers believe that the gains in the local stock market will have legs, so to speak, and authorities here are hoping that these legs will make their way into the free economic zones here in the country. I believe we have 7 such zones, and we're meeting every Wednesdays and Fridays, is it?
Yes.
To discuss each and every one of them. So which zone are we talking about in the first installment?
Well, first we're going to look at the Busan Jinhae Free Economic Zone, or BJ-FEZ for short. So located on the southern tip of the Korean peninsula, Busan boasts a beautiful scenery in harmony with the ocean, river and mountains. And Haeundae in Busan is also a very popular summer destination. Jinhae-gu in Changwon City is a charming place that organizes a very popular annual cherry blossom festival called the Jinhae Kunangje Festival. The BJ-FEZ is overseen by these 2 cities, Busan and Changwon.
Right, now I've been to the southern port city of Busan, but not to Jinhae. I'd love to visit that place in the future, though. Meanwhile, I hear the Busan Jinhae Free Economic Zone secured the top grade during a government evaluation last year.
Yeah, that's right. BJ-FEZ has attracted foreign direct investment of about $250 million as of August in this year alone. And it's also succeeded in attracting 3 global logistic companies. Now, you may be wondering how BJ-FEZ has achieved these results despite the big downward trend in investments due to COVID-19. Well, let's see how they did it. The Busan Jinhae Free Economic Zone is a hub for railway and port logistics in Northeast Asia and takes advantage of the excellent infrastructure that includes the new section of Busan Port, Gimhae International Airport, and a railroad network connecting the metropolitan area. In addition, Busan provides a healthy consumer market and high-quality labor with a population of 8 million people. The establishment of a robust industrial cluster has become the city's biggest advantage.
세계 최고 수준의 조선업, 그리고 국내 최고 수준의 항공산업, 또 동북아시아 중심이 되어있는 기계산업, 자동차 부품 산업단지와 같은 제조업이 매우 강하기 때문에 부산 경제자구역의 장점이 바로 그런 데 있지 않나 생각합니다.
The Busan Jinhae Free Economic Zone has created an industrial ecosystem where the port business, manufacturing and logistics industry grow together. This is why we should pay more attention to the post-COVID-19 era.
Right, Peter, tell us a bit about the actual benefits that companies that decide to set up shop in this area are poised to secure.
Well, there are many kinds of tax benefits, cash grants, and also tenant support services. They're provided to the foreign companies here. And if you become a tenant of BJ-FEZ, you can benefit from them all. Various incentives are provided for foreign investors that bring high value-added industries and jobs. And thanks to these benefits, a total of 1,652 tenant companies have chosen the Busan Jinhae Free Economic Zone and are currently doing business. The main reason that companies cite for choosing BJ-FEZ is the logistics industry that has formed around Busan Port.
And speaking about that, Peter, Busan Port is the 6th largest container port in the world. And do correct me if I'm wrong, Peter, but I believe it is the 2nd busiest transshipment hub.
Yes, that's absolutely correct. Full marks today, Sunny. So as Busan Port, it optimally connects the world's #1 economy, the US, and the world's #1 economic region, which is Northeast Asia. It delivers a very competitive advantage to logistic businesses in particular. However, during this COVID-19 pandemic, the logistics industry was regarded as having a particularly high risk. Tenant companies in BJ-FEZ in that area expected significant losses in sales. We met up with one of them. BNCT operates a container terminal in Busan New Port. Since the first ship docked at the port in 2012, it has grown 20-fold in size. Despite these achievements, the port operator predicted a 20% drop in sales volume due to COVID-19. However, it only dropped by 3% compared to last year. This performance can be attributed to the Korean government's quick response, effective containment measures, and close communication with BJ Fez.
The main advice that I could always give a company or a CEO that is exploring coming to the Busan Jinhae Free Economic Zone is come. You won't regret it. The advantages, the security for your company in terms of long-term future, I don't know anywhere else that you can beat the advantages that can be provided here.
Very positive words right there. Peter, what other merits does the zone offer in terms of port business?
Well, aside from the tax benefits, key administrative support is really important for attracting investments. So the port industry especially needs to be closely linked to the government, which includes local governments and various jurisdictions to carry out projects. And such administrative support is provided quickly and effectively.
Right, and like Mr. Elliott just pointed out, I hear there's some favourable remarks regarding the stable business environment of Busan Port.
Absolutely. Foreign investors care most about business stability, right? So in the case of Vietnam, many foreign companies invested in that country because they said they would build a port. But it's a decade on and there's been little progress in actually building it. In contrast, Korea gets top marks for being consistent in following through on its policies and development plans.
Right, Peter, one final question before you go. What lies ahead for the Busan Jinhae Free Economic Zone?
Well, there are big plans to make the BJ Fez a logistics and a business hub in Northeast Asia. So by 2040, a second new port will be built to expand the free economic zone and lay the foundations for a logistics R&D centre and also a joint logistics centre.
All right, Peter, thank you for that coverage of the Busan Jinhae Free Economic Zone. I believe you'll be back on Friday with a look at the Gwangyang Bay Area Free Economic Zone.
Yes, I look forward to it. Thank you.
All right, thank you.
지금 우리가 극복해야 할 최대의 난적은 방역 피로감과 코로나 불감증이라고 할 수 있습니다.
In today's session, we explore public perception of the pandemic based on a survey by researchers at the Seoul National University. For more on these findings, I have Professor Kim Moon-gyu, also the Director of the Center for Global Development at Yonsei University Health System. Welcome back, Professor Kim.
Nice to see you again.
I also have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
Meanwhile, joining our talk virtually is Professor Yoon Joo-hung, that is, from the University of Pittsburgh over in the US. Pleasure to have you with us, Professor Yoon.
Good afternoon. Thanks for having me.
Professor Kim, we'll start with you. Now, compared to the public's initial wary response to the pandemic here in Korea, there now appears to be a tangible sense of complacency. And according to the findings of the study I just mentioned, 1 in every 2 Koreans appear to hold, that is, a fatalistic view about COVID-19, believing that infection will have much to do with fate than anything else. Do you suppose this latest outbreak is a reflection of such changed public perception of the pandemic?
People get to know about corona by their own experience. Some of them are direct if you get infections. And I think most of them are indirect, mostly from the mass media. And there was a survey from the Seoul National University by Professor Yu that the younger generation, the more active generation, tends to have a fatalistic thinking. And it's compared to the study results from the May that they are getting more guessing that they're going to get infected. Well, it's partially true, but definitely it's not going to be the real, because we don't know the future. And I would like to say that one of the key factors of the Korea's success fighting against COVID-19 is the mature citizenship. So it should be maintained. And I believe that there must be a public belief that this pandemic is going to end. And we as a society work all together with the government and all the medical professionals and the general population. So fatalistic thinking is something that I want to, think it's a negative way of thinking. So we should have hope, and we are doing good, I guess. Yeah.
Right. Dr. Kwok, as Professor Kim just mentioned, in the case of young adults, that is those in their 20s, more than half of those surveyed claim that COVID-19 infection depends on fate. Now, some pundits believe this nonchalant stance is also driven by the belief that those in their 20s will not be severely affected by the infection, even if they are, that is, in hospital with it. But this is not always the case. We have had cases where people, young adults, have also suffered severe bouts of COVID-19.
Absolutely. It is. The viral infection is really pure by chance, and also the severity, even though the younger generation might have less severe of the symptoms, it's not always the time. We've had cases where people were having what we call in medical terminology sequelae from the disease. How mild that might have been, they're still having remaining symptoms from the disease they had with the COVID-19. Also, if I may personally recall a case, I've actually seen a guy in 50s who has had a non-traceable infection. He wasn't in contact with any person physically, but he came in with the symptom, and he had to be transferred directly to an ICU unit because he was going through a very severe symptoms at the time. And his vital signs and his blood test results and whatnot were showing a very dire prospect of a progress. So I need to emphasize that when younger generations do tend to think more complacently and more easily about the viral spread, as Dr. Kim also already mentioned, it's the citizenship that works here. No matter how hard the government takes its measurements on our population and whatever measures that they could take, if we don't follow and if we don't abide by the regulations, and also if we're not keeping our own social distances, there is still going to be a great chance that people will be spreading the virus amongst each other, and the younger generation, well, actually could be the center of the whole spread, and they could also become very severely ill from the virus. So we all have to keep in mind that throughout the generations, younger or older, we have to keep reminding ourselves this we have to go through it together, persevere together, and maybe someday, hopefully soon, at the end of the viral infection, we'll all celebrate together as well.
Right, hopefully. Professor Yoon, over in the US, what is the general perception of the pandemic there?
Well, as per the general perception, there has been a wider range and level of understanding on current condition since we started having pandemic from 8 to 9 months ago. In early spring, for example, there's a survey from University of Southern California that about 25% of Americans had no idea about coronavirus, and they actually didn't think they're going to be infected, over the next a few months. And about 40% of Americans didn't really think they're going to be also having any coronavirus over the next a couple of weeks or so, which are not actually true if you track it down all the way from spring to summer. That we have a lot of changes starting from the summer, that younger generation in 20s and 30s start to get a coronavirus infection. And they actually had more than 20% of all people who got infected from the summer. And now we are having a massive third wave now. And we are looking for really kind of a dark winter at this point. So the general perception has been pretty serious at this point.
I see. Professor Kim, the study here in Korea also shows that more than half of the respondents intended to get vaccinated, and over 80% of them claim that they would like to get vaccinated because they are concerned, that is, about the potential spread to those around them, especially their loved ones. How do you assess this finding?
Well, some people think that that's the way the Asian people think, but every nation has their own history and their culture. But for Korea is a very homogeneous society, and it's very unique compared to other countries. So since it's closely located to China, we had a lot of interaction with China, some good things and bad things. And every spring, we have to wear masks already before the pandemic because of the pollution. And since we had an experience of MERS at 2015, I think general population was wake up to fight against this kind of situation. So I believe that the general population were very cooperative at the beginning of this outbreak, so we could put the infection burden lower. So that was a good news for our people. And CDC in the United States, they say that more than half of the family member gets infected within a week. So if you're close contact with the infected people, you have to be care about your loved ones. So if Koreans are willing to get vaccinated, I think it's based on the trust for the government, and they believe that vaccine is going to be safe and effective, and also they do care about their close colleagues and family members, including himself. Yeah.
Professor Yoon, keeping in mind Korea's relative success in containing the pandemic, what do you suppose are the differences in civic awareness between Korea and the US with regard to COVID-19?
Well, I think that we have a different, basically different mindset, that most of the people in the United States value the personal sort of a privacy and personal space, and the freedom to use their time much more important than a lot of people probably in Korea. On the other hand, South Korea was quite successful in defending against the COVID so far. I completely agree with Dr. Kim's a comment that first of all, South Korea had a MERS infection in outbreak in 2015, and South Korean might have a glimpse of the horror caused by that infection. And secondly, being an Asian culture, I believe that South Koreans are more used to kind of follow governmental restriction compared to Americans or even Europeans. And you can see how South Koreans thought about this quarantine order kind of seriously. And the third is the government actually had successfully implemented massive testing and rapid turnaround. In the US, we have a turnaround time of 48 to 72 hours still. In Korea, probably less than 1 day. And also, South Korean government had a really strong contact tracing program that was also quite successfully prevented spreading of a disease. Whereas the United States, we don't really have that, we don't really have the system.
I see. Dr. Kwak, another interesting finding is that almost half of those surveyed believe that warnings by health authorities here were largely based on theoretical concerns. What are your thoughts on this?
Well, the warnings have to be theoretical because we are really fighting only with the tools of theory here. We've never had such virus spread before in our entire lives, and this is ever the first time for everyone to go through such a pandemic. But that being said, we are looking at real dire consequences of people who's having actually had the disease. We're having people die in the ICU units. We also had some occasions where people could also expire before even reaching the points of hospitals. We have to consider the realities here, it's I guess for the government to take a harsher measurement, that's not going to come through our skin and make people realize more that, oh, this is more of a dire situation. but rather I think it has to be taken the way through either media or some sort of modality that could reach more numerous people, in a sense that they could actually show people scary images that's actually happening at the current time. Meaning there are families currently being broken apart in different social facilities and ICU units, and there are families being broken apart whose children have to watch their older parents die in an ICU unit. Currently, yesterday and the day before, when we had a death toll rise every day or so. So we have to show these people that's actually what's going on currently, and make people realize that it's not to take something too lightly on. It's this very serious of a matter that we have to work all together to go through and hopefully get out of.
Right, because we need to raise awareness about the severity of the situation. Meanwhile, Professor Kim, as of now, we have 3 potential drugs, one from Pfizer, one from Moderna, and one from AstraZeneca. Could you take this moment, perhaps, to tell us a bit about the pros and cons of these 3 vaccines?
Okay. So actually, we have more kinds, but I would like to mention about those 3. First of all, AstraZeneca is the recently reported success story about their effectiveness, and it's kind of a viral vector out of the chimpanzee adenovirus. And they're also in the interim studies, and we don't have the final result yet. It's it also gives 2 shots within 4 weeks. So it's same for the other vaccinations, just as the previous Pfizer and the Moderna. All of them, both of them use the mRNA, quite a new one. So we don't have any experience about that yet, but AstraZeneca is something different. And they are produced in many countries, and AstraZeneca is also produced in many countries, including South Korea. So we hopefully see how it's going to come out. And something interesting is about the AstraZeneca is they give 2 dosages. Some group of the patients, study group was given full dose twice, and some of them gave half dose and then the full dose. So why did they do that? We don't have the report yet. But interestingly, the result is something different. And the group started with the half dose, had a better result, about 90% efficacy. So we don't know why yet. But if it continues to have the same result, it might be a similar result compared to previous Pfizer and Moderna. When we compare about the storage, Pfizer, we have to store it minus 70 degrees Celsius. It's very difficult. We have to make a cold chain. And for Moderna, it's also minus 20. So it's something easier than Pfizer, but still difficult. And AstraZeneca, they say it's going to use the regular refrigerator. So that's a great advantage for AstraZeneca. And finally, if we compare about the cost of it, it's estimated that AstraZeneca is going to cost about $4. And for Moderna, it's going to take about $33. And for Pfizer, they say it's going to be about $20. It's not the final price, but if you compare these 3, there's quite difference between that. So for the price being price issue, I think AstraZeneca has an advantage. And vaccine effectiveness, it's a very important thing, but all of them are interim reports, so it's something we cannot mention yet, so we have to wait for the final result. It's too early to mention about it.
I see. Professor Yoon, I understand you recently partook in a forum, in a COVID-19 related forum that is, on vaccine and treatment efforts thus far. Please tell us a bit about what was discussed then.
Okay, so as you kind of know now, the good news is the vaccines are coming on more kind of rapidly than we expected in the first time. And Dr. Anthony Pouch said that the vaccines, the first batch will be available in sometime in mid-December. Probably the most interesting and worthy to read up on is those vaccination will not be coming for everyone at the same time. It will be phased to phase 1A, 1B, 2, 3, and 4. So it's more kind of a gradual fashion because the manufacturer cannot produce all the vaccines right away. And we have several different manufacturers, including those 3 major companies that you mentioned now. So there are some guidelines suggested by National Academy of Science, Engineering, and Medicine to a CDC a couple of days ago. And phase 1A would be healthcare providers in the hospital, especially in the ICU and ER. And phase 1B would be the people who have advanced age with lots of chronic comorbidities. Also, including those who has a low socioeconomic status, because those people who couldn't afford to go to the hospital oftentimes spread the infection to the community pretty rapidly. So that's a phase 1B, and phase 2 will be grade school teachers, as well as government employees, and also public sector workers, such as bus driver, groceries, and etc. And phase 3 will be general public. So when it comes to phase 3, it probably will be a few months from now at least. I'm expecting a mid 2021. So those phases approach, which is more kind of a gradual than one time for everyone, is something that we want to also follow up through.
Right. Dr. Kwak, for Korea, you've heard about the differences, the pros and cons of the vaccines currently available from Professor Kim, keeping in mind the price as well as the logistics involved, including the transportation and storage, of course. What kind of vaccine do you suppose would be of merit for Korea to seek to secure?
Right. Well, prices aside, I want to make a statement that I personally am a huge fan of the new mRNA type vaccination, because once it's proved successful, it would be a game changer for not just the COVID-19, but it would many infections and many other modalities of diseases to come in the future. But that being said, in reality, COVID-19, this pandemic that we have with the virus, is much more dire, and it has to be taken care of in a very timely manner. We had to get a hold of vaccinations as soon as possible for as many people as possible. So we have to consider physical proximity to accessible vaccinations at this point. That being said, AstraZeneca, it being manufactured in Korea, we could certainly hope that it will reach us sometime soon. But I also think that we cannot dismiss the possibilities of using either vaccinations from China or even from Russia, because the types that are being manufactured and being developed in also China and Russia are pretty much the same as the one being manufactured from the UK, meaning most of them tend to be the vector type vaccinations which we've had much experiences with before. And not only that, one particular vaccination currently being manufactured and already being injected to Chinese citizens is one inactivated vaccinations currently manufactured by a company called Sinopharm. The fact that it's inactivated means that it's putting in a whole virus into the body so that the body can form antibodies against any part of the virus. It will have possibly less efficacy considering the fact that it's an inactivated vaccinations as opposed to it being either the vector type or even the mRNA type. But considering its safety, because inactivated vaccinations tend to be much safer than the other currently being developed, I think it'll be probably the second best alternative choice to the brand new and much more higher prospected mRNA type vaccinations or any other vaccinations that has to come a very long way to reach our country. So my personal take is that second best alternative, possibly the inactivated vaccinations from a neighboring country, or possibly the adenovirus vector type vaccinations that we are currently manufacturing on our soil.
Right. And despite the efforts on the vaccine front, Professor Kim, there are those who are claiming they will not get vaccinated because of concerns about possible side effects. Could we take this moment right now, very briefly, to touch upon some of the potential side effects after getting vaccinated?
Well, mostly they have flu-like symptoms such as fever, sore throat, or pain on the arms, that injection site. And if you think about the possible vaccination for corona, they have to get 2 shots. So sometimes they are reluctant to have the second shot because they have a bad experience with the first one. So we have to think that the symptoms of that flu-like symptom might be the proxy of that effectiveness. So I hope that FDA will prove that it's going to be safe, and we have to wait for the results until they have a subjective and thorough review about those vaccinations.
Right. Professor Yoon, one very brief question. What is the response over in the US with regard to reports about COVID-19 vaccination starting next month in the US?
The general response is we are really enthusiastic about getting vaccines available in the foreseeable future. There is also concern about the safety and potential adverse effect of a vaccination, as well as the efficacy, for a newly generated vaccines, because of those compounds were not, scientifically proven to some extent, especially with mRNA vaccination. People are worried about a potential protein synthesis, which can be happening randomly in the cell. So these things are kind of the major concerns that we have. Other than that, vaccine is not just taking care of all the issues simultaneously, one for all. We are also kind of trying to develop some early phase treatment strategies, including antibody targeted, antibodies, for example, generated by a Regeneron,
right.
monoclonal antibody cocktails things. Yeah.
Right. I see. All right, Professor Yoon, thank you very much for making the time to join us live from the US. And Professor Kim, thank you for being with us. And Dr. Kwak, as always, thank you for sharing your thoughts.
Thank you.
Right, well, that is all the time we have for today. Tomorrow, we take another look at the efforts of the academic arena amid the pandemic. In the meantime, do take care and thank you for watching.